The APGAR score was developed to provide a rapid, systematic method of assessing an infant's condition at birth. When used correctly, it is useful for standardized assessment and provides a mechanism to document the neonate's transition after birth. It is designed to be useful for a limited time frame. APGAR scores are affected by factors such as gestational age, maternal medications, trauma, congenital anomalies, hypovolemia, and hypoxia. An APGAR score is performed at 1 and 5 minutes after birth. The 1-minute score determines how well the baby tolerated the birthing process. The 5-minute score tells the doctor how well the baby is doing outside the mother's womb. In rare cases, the test can be done 10 minutes after birth. The APGAR test is done by a doctor, midwife, or nurse. The healthcare provider examines the baby's breathing effort, heart rate, muscle tone, reflexes, and skin color. Each category is scored with a 0, 1, or 2, depending on the observed condition. An APGAR score is very easy to remember. To have a score of 0, it means that all the observed conditions are completely absent. There is no heart rate, respiratory effort, muscle tone, reflex irritability, or color. A score of 2 means that the infant's observed conditions are very strong. The heart rate is over 100. The respiratory effort is good, which can be shown by a crying baby. The muscle tone is strong because the baby is actively moving. Reflex irritability is present because of a vigorous cry, and the baby is completely pink. A score of 1 means all observed conditions are present, but not as strong as they could be. Heart rate is less than 100. Breathing is slow and irregular. There is some muscle tone. Reflex irritability shows a cry, and some of the body is pink, but extremities are blue. The U.S. Preventative Services Task Force recommends instilling a prophylactic agent in the eyes of all neonates to prevent neonatal conjunctivitis. This is an inflammation caused by sexually transmitted bacteria acquired during passage through the mother's birth canal. This prophylactic medication is targeted primarily towards preventing infection from gonorrhea. Without prompt treatment, this infection can lead to blindness. Erythromycin and tetracycline are considered effective medications as they are both bacteriostatic and bactericidal. These medications need to be given within 1 to 2 hours of birth. To administer, you apply 1 to 2 centimeter ribbon of ointment to the lower conjunctival sac of each eye. Eye prophylaxis for neonatal conjunctivitis is required by law in all U.S. states. Vitamin K is a prophylaxis that is given intramuscularly. It is given because the newborns don't have the intestinal flora to produce it themselves. It helps with the formation of clotting factors. It specifically helps because the newborn may suffer bruising during passage through the birth canal, and this can prevent excessive bleeding. To administer, you give a 0.5 milligram dose to the newborns weighing less than 1,500 grams and a 1 milligram dose to the newborns weighing more than 1,500 grams. These measures may be diluted for preterm infants who have no muscle mass.